Congressman Henry Cuellar in Starr County today, where he got an earful from county leaders.
They say their only hospital is now at capacity, and they're frustrated because they say they've received very few vaccines. Here's Channel 5's Tanvi Verma.
Starr County Judge Eloy Vera says that in light of the increase in COVID cases and no more bed space in hospitals, they'll need 1,000 vaccinations a day, which is a lot more than they're getting now.
Our numbers have been increasing drastically as far as positive cases in our county. Yesterday, we had to request the help from the military for personnel to assist us at the hospital. Our hospital beds are at capacity right now for COVID.
Judge Vera says soon they'll have to start transporting patients to other hospitals, something they did during the first COVID surge over the summer, and their resources remain limited. Vera says they're still waiting to be reimbursed for the $1.8 million they had to spend on things like testing.
I just find it a little unfair that counties have to carry the burden when the money, it's our money that's in Austin.
Judge Vera also expressing concern with COVID vaccine distribution. According to Texas Health and Human Services, Starr County has received a total of 1,300 vaccines, and Vera says that's not nearly enough.
Hidalgo County, for example, the first batch that they received 22,000 vaccines. We got 700. We should get around 10% of what they got. So we should have gotten at least 2,000 vaccines. That is, I guess, what bothers me when I say that we're not getting our fair share of vaccines.
Congressman Henry Cuellar visiting Rio Grande City on what a press release from his office referred to as a COVID relief tour. He said the slow rollout of vaccines is because Texas hasn't distributed even half of the amount of vaccines they have.
As of last week, they had only sent out 44% of what they've gotten from the federal government.
And he says compounding the problem, the vaccines go from facilities to the state, then to the counties they need to go to, which he says takes far too much time. He thinks the vaccines should go directly to the counties.
It was basically from the facility where the vaccines were at, put them on a UPS or Federal Express to the state. But that's not the answer. Then what happens when it gets to Austin? How does it get to Rio Grande City?
Congressman Cuellar says one of the goals of the Biden administration is to cut out the extra step of involving the state during vaccine distribution, which he says would help Starr County get to their goal of 1,000 vaccinations a day. Tanvi Verma, Channel 5 News at 6.